Okay, so we'll start with what we found. Um, well, we were going to our topic we selected was childbirth and maternity leave, and we chose to look at the costs related to child delivery, the most common complications of childbirth, and how long the mother stays in the hospital, and and postpartum care and maternity leave.
Okay, so our country first, I guess. Prenatal care. Who receives prenatal care? It's every pregnant Dutch citizen. Every Dutch citizen has like a basis package, which is like mandatory. So that includes that specific care. Um, how often do you see the doctor? It's advised to visit your doctor 24 times. However, if there are any complications, you will have to consult a hospital and or doctor as soon as possible.
Yeah, and what does prenatal care consist of? We have a blood test at the 13th week. The mothers have a blood test, of course, which tests you on infection diseases or any antibodies against blood types. And this test is free. Um, a combination test or a NIP, I don't know if the translation is good, but it's a screening on Down syndrome, Edwards and syndrome, and Patau syndrome. And the combi test is included in some additional insurance packages, but the NIP test is at the parents' own expenses, and it's around 170 euros, which is almost the same, I think, in dollars. We have a 20-week echo, so it's a check on physical abnormalities, and it's also included in the basic insurance. And there's a 20 weeks whooping cough vaccination, which ensures your child is which makes the chance of getting whooping cough for a child at birth very small.
So I have a quick question.
Yeah.
For that screening test about the Down syndrome, Edwards, and the other, is that included on some insurances or no?
Yeah, some additional insurance. Wait, which the blood test or the combination test? Which the combination test is included in some additional packages. So if you pay more, you get a package where that is included. But the NIP test is included in no packages.
Okay, so it's not common for like every child to be screened for that, correct?
Yeah. Well, I think most parents get it, but
Oh, okay.
I think so. But I'm not sure. I can look into that.
Yeah, I was just wondering. That's okay.
Yeah. Well, and the rest of the 24 doctor visits are just checks on the baby and if it's growing or heart abnormalities. Yeah.
So the postpartum, how long does the mom stay in the hospital? The new mom and her newborn can leave the hospital just hours after the childbirth. The mom has to stay in the hospital for 48 hours if the child was born through a C-section. Also, 1/4 of children is born at home. Mother and child have a right to 48 hours of maternity care after birth. So a maternity caregiver comes to the mother's house and helps out for a few hours a day. But if the mother experience or the baby experience any complications, it's of course natural to stay longer. When is the mother's first postpartum checkup? The first postpartum checkup is 6 weeks after the delivery. What does the postpartum checkup include? To see if the mother has any changes or experience pain concerning urinating, defecation, community, prolapse complaints, pelvic and or abdominal pain complaints, pain around possible scar or scars.
I have a question.
And then yes.
That maternity person that comes to their house, is that like somebody who like went to school for that, or what type of person does that?
Yes, that's I think that's yeah, they definitely are just nurses, I think. That's the same who are coming before prenatal, yeah. Yeah, so they definitely have a degree, yeah.
Thank you.
I don't know what degree though. Also, since July last year, dads in the Netherlands also get 5 weeks of paid leave to be with their baby. So that's also great. And yeah, that's it, I think. Let's see. Oh yeah, cost in the Netherlands. Well, the average cost of a child, we found a great, I don't know the word for it.
Table.
Oh yeah, table, yeah. With the amount of kids and what you can spend each month, and how much of that will on average go to your child, and it depends on how much you can spend and how much kids you have. Also in the I actually should have calculated how much on average it is, but we'll show it in the PowerPoint later. Also in the Netherlands you get do you know the word for it, Luca? Kinderbijslag.
Child
Yeah,
money for children.
yeah, some
Yeah.
child
Child
support.
support.
Yeah. Which is every month, depending every 3 to 4 months, depending on how old your child is. So from 0 to 5 years old, it's 223 euros. 6 to 11, it's 271 euros, and 12 to 17, it's 319 euros every quartal. What is that? Quarter of the year. Yeah.
25% of the year.
Yeah.
So next slide. Time of maternity leave, paid or unpaid. So in total, the mother can take up 6 weeks before the birth and 10 weeks after. So in total, the mother has right to at least 16 weeks or paid leave from work. Of course, she can take more, but that's unpaid.
Yeah, and you can also take like 4 weeks before birth, and then 12 weeks after birth. So you have you can decide that on your own. Yeah.
Health insurance costs. Children are automatically co-insured without extra cost. The average cost of a health insurance is 124 euros a month.
Per person, yeah.
Is there out-of-pocket cost to have a baby, or is it covered by insurance and or tax?
I thought it was in the basic package.
Yeah, the basic is like 105, I think. But 124 is like added so much more to the insurance. So including eyes
Yeah.
or hearing or
Yeah, it is included in the basic package. Yeah.
So you just up your insurance and then it's covered?
I don't even think you have to up your insurance. I think it's
Oh,
Uh,
it's
in
just
the
automatically covered.
yeah, I think so. Yeah.
yeah. So if you up your insurance, it also covers your child with whatever you up it with.
Yeah.
Pretty crazy. Okay, thank you.
Yeah. Let's see.
More statistics.
Yeah. So the daycare options. Well, in the Netherlands, there are loads of daycare options allowed. Yeah, allowed, not allowed. Available. I mean. And if you have if it's difficult for you to pay for that, there's also you can also ask support from the government who help you with that. But it's also not uncommon for grandparents to help out with babysitting the children. Yeah. Yeah, you go.
Stats on if mom is married, single, or divorced. Okay, so we only have the 22% are one-parent families and 78% are two-parent family.
Yeah, and the 21% is mostly consists of single mothers without the father.
Most common complication in birth processes. Common complications are inefficient progress labor, which is dilation or expulsion, extensive blood loss after delivery, and placenta not being born spontaneously. Yeah, any questions?
All right.
Right.
So I can start us off. So for our prenatal care, who receives prenatal care, 77% of women start their prenatal care in the first trimester. Less than 5% make it into like the third trimester. So there is a couple that like start and initiate prenatal care later. And then almost 2% just provide or get like no prenatal care at all. A big indicator on this study was the age that the mother was. So if they're in their 30s, they're very likely to start their prenatal care right away in the first semester. And then if you were under the age of 20, you're less likely to start prenatal care in the first trimester, probably due to they're young and they're probably trying to hide it or they don't know where to go for resources. And then the percent receiving no care or late care was highest for teen mothers. So how much do you see your doctor? Uncomplicated pregnancies, you go every 4 weeks for the first 28 weeks. So that's 7. And then between 28 weeks and 36 weeks, you see them every 2 weeks. So I'm doing like the math here. And then anything beyond 36 weeks, you see them weekly. So that would be 4, 7, 11. It'd be about like 12 to 14 visits. So you guys almost double us in prenatal visits, right? I'll write that down as a talking point. Okay. And then what does our prenatal care consist of? You normally visit anywhere between 10 to 12 weeks to confirm your pregnancy with an ultrasound. And then you do checkups like your blood pressure, weight check, listening to the fetal heartbeat, screening for gestational diabetes and anemia, and then you get the tetanus and whooping cough vaccine as well. We do it at 28 weeks. I think you guys do it at 22 weeks. We do it at 28. And then we also do the blood test like you do to make sure that there's no crossing of positive or unpositive. So, and then we'd go and give the RhoGAM shot at 28 weeks, depending on those results. And then,
Go ahead.
go
Sorry.
ahead, Jess. Go ahead.
Okay, so how long the mom stays in the hospital? It's actually like a requirement for most hospitals of like how long they have to stay. So it was 48 hours for a vaginal birth and 96 hours for cesarean. And I've heard from a lot of like moms that they wanted to go home because maybe it wasn't covered by their insurance or they didn't want to pay the extra cost, but like the hospital was pretty like adamant about it. But obviously they can't force anybody to stay. And then one is the mother's first postpartum checkup, 6 weeks, just like you guys. And then what does it include? You look at the incision, if it's a C-section or the perineum area. You check the uterus, ovaries, cervix, breast, just basically their whole body, and go over their general health and do a quick mental health screening if they have like postpartum depression or anything like that. And then the cost is where it gets kind of confusing. So I looked at a study from 2011 that looked at 2 different, I guess like companies, like research companies. And they tried to come up with a figure of what it costs. And it was like $210,000 to $270,000. And that was up until the child is 21. And I don't know, from my experience, I think you're still getting a little bit of help until you're done with college, which is 22, 23. So I don't know if I would really agree with that figure. And then, I mean, there are some people that don't get any help after 18 or even 16. So that's an interesting thing. And then the time of maternity leave. So in the United States, they actually aren't required to give maternity leave. It's one of the very few countries that doesn't guarantee like paid maternity leave. And the like International Labor Organization has said like everybody should have at least 14 weeks of paid maternity leave for like all employed women. But I guess we haven't made that change yet. And then the leave for women, only like 12% of workers have access to the paid leave through their employer, which I thought was really interesting and sad. Only 12%. And it's only increased like 0.26 percentage points per year. So it would take like another decade before even half of the women in the US would get paid time off if we were like continuing that 0.26 percentage points. And then the average annual cost, I think you guys did monthly, and I calculated it, the like difference or whatever. So your monthly cost came to $1,670 for a year, and our health insurance cost can be up to $10,000, but the average has been $3,852. And I found an interesting thing talking about inflation. So in 1960, the average cost was $146. And then if you adjust for inflation, the costs now are 9 times higher when you're adjusting for the difference in costs. And then, let's see here, I'm missing one thing. Oh, the state law like requires that you have health insurance. And so your insurance, it's like required that your insurance covers the 48 hours and the 96 hours. But some people like it still is an expense.
And then kind of to sum up what Jess just said, our healthcare, which like we didn't do our presentation on healthcare, but just for like a little bit of a background, over here, our healthcare is private. And so the government does not own it and the government cannot control it. There's like a couple hospitals like VA, that is our Veteran Affairs, where they allow public health care. But other than that, over here, everything is for profit, including our insurance companies. And so they kind of have been able to monopolize and say, oh, I can charge whatever I want because there's only 4 of us. Well, now what happened was that there was a law passed, I want to say it was like about 8 or 9 years ago, that says you cannot get out of state health insurance. So now, because down like where, because in our states, there's different states that have poverty lines. And so like Minnesota, you're pretty well off. In Arizona, Texas, you see a lot more poverty. So kind of things like that. Well, then their insurance companies down there charge less. And so like my family was going through a health insurance company in Arizona because they charge a lot less in Minnesota. Well, now there's a law that says that's illegal and you have to get your health insurance in the state from which you are from. And so since now that's like locked in, those health insurance companies have raised their cost. And now it's a law that you have to have it or you get fined at the end of the year. And so that just like encourages them to charge what they want. And as an example, like after, because that's the cost of having a child, and then our health insurance will go ahead and pay for some of it. But on average, it's like anywhere from like 15,000 to like upwards of like 100,000 that you could owe out of pocket even after your insurance. So my aunt, I was talking to her, she had twins and she obviously had to have a C-section. And after insurance and everything paid for what they were supposed to and their deductible, they owed $42,000.
Oh my God.
And my cousins are 19 years old, and my aunt and uncle still pay $150 every month as part of their payment plan for that hospital bill for birthing their children almost 20 years ago.
Wow.
Yeah. So
That's
just
crazy. Yeah.
just a little perspective there.
That's like the cost of sending them to college. That sucks.
Yeah, they're in college and they're still not paid off from being born.
Wow.
And then if you have complications, you get charged more. As if
Wow.
the mother has a choice if they have complications or not. But more statistics on the United States side. Daycare options for infants and toddlers. I found that almost 40% actually are exclusively cared for by a parent. So one of the parents will stay home. I know once you surpass that toddler age, a lot of parents will go back to work. Otherwise, the other thing too, something that's becoming quite popular is if you have a lot of children, like if you have 3-4 children, one parent might stay at home because it might be more cost efficient. And so I knew a nurse and her husband actually quit his job and stayed at home because they had 4 girls. And for the cost of them to go to daycare, he was an electrician, was the cost of his salary minus like, I think they're only coming out like $300 or $400 a month after he was getting his salary with what the child care was. So it made more sense for him to just quit his job and for her to just work an extra shift. So that's kind of why I feel like that number is kind of high. And then about 30% do home-based childcare. So examples is either a paid or unpaid provider who already know the child. So mostly 30% by family, friends, neighbors. I thought that our number would have been higher, but only 12% go to like a daycare center. I don't know, is daycare centers popular over there or no?
Daycare, what did you say? Daycare?
Yeah, I'm like wondering, did either of you go to daycare?
Yeah,
Is
mean,
daycare a
I
thing?
went. I think it's pretty popular.
yeah, pretty
I
common.
think we
Yeah.
even had a number of how much it was. But it wasn't that expensive. It was like €8 per hour, I think.
Well, it's pretty
What?
expensive.
I mean,
Wait,
not so much as my salary.
no.
Well, yeah, didn't you say though your minimum wage the other day was like $7 though?
Yeah, and can you imagine like the people that probably have the daycare are like 30-year-olds or something? They should be paid more than that.
Mm.
Well, no, I'm saying, if I'm a single parent and I make €7 an hour and then my child care is $8 an hour, doesn't make sense for
No.
daycare.
Yeah.
You
it's
don't
pretty-
have any like companies or I don't know, anyone helping you out with that if you have like a problem as that,
like that.
as such?
Are you asking for us?
Yes, yes.
Oh, for us, I believe our minimum wage, it kind of depends on state, but I believe right now Minnesota is anywhere from like 8 to 12. If you're a small business, like if it's a family owned business, then they can pay you less versus a corporation. But then I believe like California minimum wage out there is $15 an hour. But I believe, even when I babysit, I make $15 an hour. That's like that's like my average.
That's,
And then if I have 2 kids, I get $30 an hour.
that's insane.
So I don't know. I find childcare kind of expensive, and the parents that I nanny for think that they're getting a heck of a steal because they really trust me. They're like, "Oh my gosh, I can't believe that's all you charge." It was like $30 for 2 children. But anyways, yeah, I believe our childcare is kind of expensive as well. And then other was identified as 20%. So either they use care irregularly or it used 2 different types of childcare and they're unable to identify their primary source. And then stats on marital status of the mother. 40% of our births are out of marriage. And so that is about double the amount of yours. And then the study actually found that the greatest increase, because our births out of marriage has actually been on the rise. And the group that it's rising the most out of is women who attend some college. So they're in college and then they end up not finishing college because they have a child. So yes, and then most common maternal complications in the birthing process, I had a table that I will show in the presentation. About 33% of ours is cardiovascular conditions. So they have like cardiomyopathy, high blood pressure, things like that. And then 13%, it just says non-cardiovascular, doesn't specify. 13% is infection, 10% hemorrhage. So those are kind of like the bigger ones. Something that I found interesting is that it's like less than half of a percentage for anesthesiology or whatever, anesthesiologist. I thought that number would be higher.
Me too.
So yeah, and I believe, what was your most common? I think your most common was hemorrhage.
Insufficient progress labor. So that's
Yeah, delayed labor, and you also had extensive blood loss. So yeah, and our prolonged labor didn't even make it on the list.
Yeah, I don't think they even see it as a complication, or they just give you what's the drug? I don't even know.
Pitocin.
Pitocin, thanks.
You two had your maternal clinical rotation, right? Luca, Jonas, didn't you have your maternal rotation?
Rotation, what do you mean? I don't
Your
Okay.
internship or your clinical, where you go into the hospital. Did you have that yet or no?
No, we didn't go to a hospital at all yet, so no.
Okay, I thought you had yours already.
No.
oh no, that's like in the 4th year, I think.
Oh, okay. Aren't you
Yeah,
learning about
yeah.
maternal stuff right now though?
Yeah, but it's just at school.
Theory.
We're not going to a hospital to.
Okay.
Do you guys go to a hospital to learn about that stuff, or?
So we do it, it would be our first year in the program, but it would technically be our third year in school. So that's right when COVID hit. So some of us made it to the hospital, some of them didn't. I made it only for 1 day, but I saw a C-section and a vaginal birth. Did you make it, Jess?
Nope.
Nope.
Never seen a baby.
But
So that's pretty interesting. Yeah, we don't do that. We don't do that. We don't go to a hospital to see that. So
No, especially now with COVID and
yeah, with
everything.
COVID, yeah, but even if there wasn't any COVID,
Yeah,
I
no
don't think-
excursions or anything.
no.
But you said something about like monopoly or something, or
yeah,
capitalized insurance or something.
yep, our health
And
insurance.
also the hospitals were monopolized or not?
The hospitals are private owned here. They can, I guess, yeah, they can charge what they want. Mayo is a big one. Alina is a big one. Sharps, Scripps, Fairview. So we kind of have like, they have their own little branding system. And then our insurance will only be accepted in certain hospitals. So like if I went to, I'm not sure if Alina, so I'm Health Partners, that's like my brand of insurance. So everybody picks a brand of insurance. I believe in Minnesota, you have a choice of only 4. All the other ones are too small to like, they went out of business and things like that, or they just switched over to other states since that state law thing passed. But I believe I cannot go to Alina. I'd have to double check, but since they're out of network, my insurance wouldn't cover anything if I had to go there. So say I was up north, I couldn't find a Mayo, I had to go to Alina. My insurance would be like, well, we don't cover Alina, we don't work with Alina, and so I'd have to pay everything out of pocket. And our insurance here, like Jess said, runs about double what yours does, and our insurance does not cover much. So like I went to the ER for chest pain, and my total bill for 4 hours came out to $3,800. $1,000 for the doctors, $1,500 for the use of the building, okay? Because I used the room, and my medication, because they gave me a shot and did some blood draws to make sure I wasn't having a heart attack. That came out to $1,000. And then there's all these other little fees. They charged me for my COVID test. That was mandatory. That was $285 and my insurance won't cover it. And out of all that, so my family pays like $2,000 a month, and we have to pay $3,000 out of the $3,800.
Wow.
And I had an infection in my heart, is in the perineum area. It's pericarditis. And since it was a serious complication, the hospital charged me even more.
Yeah. Wow.
Because they triage it and they're like, yeah, it was pretty serious. Good thing you came to the ER. However, since it was more of like a higher acuity, we're gonna charge you more.
Wow.
Isn't it like confusing? You have all these states in America and all these health insurances, and that health insurance only works in that state. And
yeah, I
would
cannot believe
confuse me.
that like your insurance is so low and that the cost of a child is just included.
Yeah. There's some, yeah, it's called own risk or something. Yeah, that's literally translated, but you have to pay some something, but not that much. We would never have to pay that much for just a hospital visit, like you did. No, that just wouldn't happen.
No.
No. Yeah. So, what's that? Oh.
I think so. And you also do every United States citizen deliver in a hospital or also at home?
We didn't look up stats for that. I can look into that real quick. That's a good question. I think some of the things that we thought that we would look up, we interpreted differently.
Yeah, maybe.
Yeah, I do. I'll look that up real quick.
But I think it's like 2% or something. Like it's super low.
Yeah.
They're
No,
delivered in a hospital.
Right. Like, I mean, there are accidental, like, oops, we didn't make it to the hospital kinds of people, but like very few people plan to have a birth outside of the hospital, especially the first birth.
Oh, I thought you said only like 2% go to the hospital.
Oh no, sorry. Opposite way. Sorry.
yeah, the Netherlands was actually known for how much of the children are born at home. So, but it is very declining very fast because, like, polyclinical births are just safer and there are people to help. And I was actually born at home, so yeah.
Same.
Yeah, ours it says 98.4% of births take place in a hospital in 2017.
Yeah.
So everybody
if you
get over here with their children.
Mhm.
if you deliver at home, it would be more cheaper though, right?
Delivery.
Or maybe the Jacobs take all the money.
We have like midwives and things called doulas, and I've heard those are very expensive.
It says having one vaginally, obviously you can't do a C-section, but at home is anywhere between $5,000 to $11,000.
I feel
So
like
about half the cost,
Yeah.
possibly, of a
Yeah.
hospital visit, possibly.
You would think that more people just give birth at home, right? Because it's so expensive, or
But
does it
then
not
if something
sound like
goes
that?
wrong,
yeah.
then you gotta go to the hospital and then you're paying for both.
Mhm.
And your insurance might not cover the at home because over here in America we're also very stigmatized. And so insurance might be like, that doesn't count as real medicine. We're not paying for that.
Yeah.
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 There's like certain therapies. So like say your muscles are sore, there's muscle relaxers. Insurance will cover for you to take a pill, but for you to like go and get a massage or try acupuncture or something kind of like an alternative therapy to medication, they will not cover.
Yeah.
So everybody's over here just taking pills.
Yeah, lots of that isn't in our basic package as well. You can get additional packages to cover that, but it's not in insurance. No.
I really
All right.
want your
So,
basic package.
I'm sorry.
I said I really want your basic package. It sounds
Yeah.
wonderful.
I want
Yeah.
a socialist government. Yep.
It's nice.
Yeah. So
We can start the new meeting, but work on the conclusion in that one before we record and then present.
Yeah,
Yeah.
that sounds good.
yeah.
Okay.
Okay, I'll hop back on.
Nope.